Hello, I'm Dog is Happy, and I'm here to talk to you today about politics. Before I got a job, I never really paid any attention to politics. Then I realized that a good chunk of my paycheck, about 19.6%, was going to crap and supporting ideologies I didn't believe in. And it's about time, too. I've sat on the sidelines for far too long, and I've had enough. Now, I'm neither a Republican nor a Democrat. Personally, I believe that anyone who votes on a candidate should based strictly upon their political party is a dumbass. If you're offended by that, then, well, I'm sorry, but if you're too close-minded to even give someone the time of day because of their political orientation, then you're just stupid and part of the problem rather than the solution. The only way a democracy can survive is if there is loyal opposition in the form of multiple political parties. Don't believe me? Look at our nation's history. Every time our nation has been at war, aside from the Persian Gulf War in 1990, both Congress and the White House have been controlled by the same political party. War of 1812, the Democratic-Republican Party. 1846, the Mexican War was controlled by the Democrats. 1861, the American Civil War was controlled by the Republicans. 1898, the Spanish-American War was controlled by the Republicans. 1917, the U.S. involvement in the World War I officially begins. We were controlled by Democrats. 1939, World War II, were controlled by Democrats. 1945, the Cold War, we were controlled by the Democrats. 1950, the Korean War, were controlled by the Democrats. 1960, Democrats. Vietnam War. 2001, the War on Terrorism, the Republicans. Now, it may look like I'm dogging the Democratic Party because they're responsible for more wars, but I'm not. All I'm doing is stating the facts. All of this information is available online. If you don't believe me, look it up. I challenge you to prove me wrong. All of these dates, you can't dispute history. Now, on to more recent events, specifically healthcare. I believe that the current healthcare system is out of control and needs to be reformed. But not like this. If you do not believe that I do not believe that the U.S. government should be in charge of my healthcare. Quick example. How many of you remember your last visit to the Department of Motor Vehicles? Last time I was there, I was forced to endure mountains of paperwork, multiple long lines, and cold-hearted, snobbish clerks with a "why should I go out of my way to help you? Get to the back of the line" mentality that can't even copy my name right. Did I mention that they're switching to a 4-day work week in some places? Do you really want your healthcare to be like this? I know I don't. Also, with the swine flu pandemic that is going around, I guess that should be H1N1 flu pandemic, I'm even more upset about the thought of my healthcare being controlled by the federal government. This is why. According to Fox News, on August 18th, 2009, you can look this up on their website, Health and Human Services expected to have 120 million doses of the vaccine by October 15th, but it now thinks it will fall short of that, only 45 million, although that's expected to rise to 85 million doses by the end of October. Today, according to ABC News, the government has initially said 40 million doses would be available by this time, but in reality, only 1/4, about 11 million, of those are out. About 150 million doses will be needed to cover all Americans. The administration has ordered 250 million doses, with 16.5 million doses expected to be out the door by the end of today. 16.5 million? According to their original estimate, not only are they 11 days late, but they're also 103.5 million, that's million with an M, million doses behind schedule. People are dying because of this, and our government is helpless. And they want to be the ones that revamp healthcare? No! Even worse, and this is the deal breaker in my opinion, my father is a veteran. He served our country for 41 years, and he gave his blood to protect us, and he can't even get the health care he deserves. Thank God his injuries aren't life-threatening, and that his current employer offers decent health care, or else he'd be in real trouble. Why are we going to other countries to look for examples of federally controlled health care? We have our own already. Federally funded healthcare programs like the VA and Medicare are almost complete failures. According to Newsweek, Medicare is going to be completely bankrupt by 2017, and the Department of Veteran Affairs is chronically underfunded. Not just once or twice, but if you go back and look, the funding for VA has been late in getting approved by Congress 20 times in the past 23 years. I understand that President Obama has made legislation to help correct the VA funding shortfalls, and I applaud him for it. It is something that should have been done a long time ago. But I'm still sorry. Medicare is still on the fast track for going bankrupt, and so I'm just going to say no thanks to a federally designed healthcare system until those things are fixed. What I would rather see is getting the cost under control. When you go to the hospital, do you know what you're actually paying for? All I get is a bill from my insurance company telling me to pay up. If hospitals actually advertise their prices like every other institution in America, people will be able to make informed decisions on where to go. I mean, it's called capitalism. The free market. It works. Use it. This would cause healthcare providers to lower their costs so that people would go to their facility. I also don't understand why insurance companies can't sell insurance across state lines. Blue Cross Blue Shield, for example, is offered in practically every state. But if I want health insurance from them, I have to go through the one of them that happens to be in my state. I'm fortunate in the fact that I live in a state with 29 different healthcare insurance providers. So there's a lot of competition and my rates are relatively low. But there are some states that have as few as 8 healthcare providers, leaving all the power in the hands of a select few. Why can't I buy health insurance through Alaska if I want to? Open up the borders to competition. It will generate lower costs for everyone. Another solution: get control over medical fraud and get rid of the frivolous lawsuits. These cost lots of money and are an easy way to save money. Just get rid of them. Let's put in the work now and make sure that whatever version of the bill that gets put in front of President Obama addresses this, and make sure that it doesn't happen anymore. The bill is over 1,000 pages anyway. They might as well add something that's going to be helpful and save us money in the long run. Overall, I think that healthcare should fall under the 10th Amendment and be the responsibility of each individual state. All the Constitution says about healthcare are 4 words in the preamble: promote the general welfare. Keyword: promote. Last time I looked, promote didn't mean provide. If you want to pay taxes to support a government-run healthcare, then move to a state that provides it. If not, move to a state that doesn't. One of the great things about America is our widely diverse population, and we should embrace this. But when the government bureaucrats, who have been in the office for decades and are completely disconnected from society, start to mess around with something as essential as my healthcare, it's time to say that enough is enough. We as Americans need to stand up for ourselves and have a voice. If not, we're just going to be trampled and have decisions made for us. Stand up, America. It's our time now. Fight for what you believe in before it's taken away. Night, America. God bless.